Topic of my talk is assessment of LV function by strain imaging. So there are different variables which we use for the assessment of LV function. I'm not going to discuss all these, but there are pitfalls of conventional methods. Conventional echo methods are indirect measures of systolic myocardial performance, and ventricular geometry can affect the analysis from conventional methods. So these are the pitfalls. If you look at the first image, the EDV is 125, ESV is 70, EF is 56, and stroke volume is 55. So this looks okay. But in the next image, if you see, the LV is dilated, volumes are increased, EF is low, but stroke volume is good. Stroke volume is still 70. And in the third image, if you see, the LV size is small, EF is normal, but the stroke volume is reduced. So these are the pitfalls of conventional methods. So there was a need for a more robust way of assessment of myocardial performance, which can determine the direct quantitative myocardial performance and also assess the regional myocardial function and evaluate geometry independent LV function. And in fact, myocardial strain fulfills all these criteria. So what is the strain? It is the magnitude of deformation. I'm not going into detail of that. Actually, the left ventricular myocardium undergoes a complex multi-dimensional deformation during the cardiac cycle. And there are three main types of strain. One is the longitudinal strain, the other is the circumferential strain, and the third one is the radial strain. The longitudinal strain denotes shortening of the LV along its long axis. The circumferential strain depicts reduction in the circumference of the LV cavity during cardiac cycle, and the radial strain denotes thickening of the LV wall along its radius. So we can measure the strain by two ways, either by tissue Doppler imaging or by speckle tracking. Speckle tracking is the commonest way of measuring the myocardial strain. So in which conditions we can apply the myocardial strain? Among the three types of strain, longitudinal strain is the most commonly used, and because we know the standard values and there is less intervendor variability, so my longitudinal strain is the most commonly used strain, and these are the conditions in which we can apply the myocardial strain or the longitudinal myocardial strain. So cancer patients are the most common patients in which we use the myocardial strain. When reduction in LVEF during chemotherapy is established, it may be too late for treatment to allow complete recovery. So reduction in myocardial strain precedes significant change in LVEF. So global longitudinal strain has emerged as an early marker of cardiotoxicity. And according to these societies, the evaluation of adult patients during and after cancer therapy, they recommended use of global longitudinal strain. And if there is reduction of 15% or worsening of 15% global longitudinal strain, then it's clinically significant. The other conditions in which we can use myocardial strain or longitudinal myocardial strain is the cardiomyopathy group, especially the hypertrophic cardiomyopathy, in contrast to LVEF, which very often is normal in hypertrophic cardiomyopathy. Longitudinal strains are reduced in early stages of the disease, and longitudinal strain is reduced at the sites of hypertrophy, commonly in the interventricular septum. Because the myocardium here is not normal, there is myocardial disarray as well as myocardial fibrosis. And the current clinical practice guidelines for the management of hypertrophic cardiomyopathy include strain echocardiography for evaluating longitudinal function in early disease. The other condition is cardiac amyloidosis, and in cardiac amyloidosis, longitudinal strain is not only gives you the prognosis, but also is important from diagnostic point of view. Global longitudinal strain is reduced in patients with cardiac amyloid, but there is apical sparing, and which is called cherry red on the top, or sparing of the apical sparing. Then we can use the myocardial strain in valvular heart disease, although it's still not in the guidelines, but maybe it may come in the future in the guideline. And then come to the myocardial strain in HFpEF, and this is another condition where we can use the myocardial strain and global longitudinal strain, very promising method to identify patients with mild systolic dysfunction, which is not reflected in reduced EF. Another condition is hypertension. I think next session is on hypertension. So speckle tracking echocardiography can identify subtle adaptive changes of LV systolic mechanics in hypertensive patients. Then come to the patients with ischemia. We can use the myocardial strain to diagnose ischemia, especially while doing the stress echo. Then come to the left atrial strain. Left atrial strain is also important because it actually signifies the presence of increased filling pressures, or it correlates with the LV diastolic dysfunction. And speckle tracking echocardiography has proven to be useful and applicable in the assessment of left atrial function. Left atrial function is divided into reservoir, conduit, and contraction phase. So these are the three types of strains of LA strain, and these are the different values for these strains. And the reservoir strain, also referred as peak atrial longitudinal strain, it is considered the most important due to its prognostic value in cardiovascular disease. Both LA reservoir and contraction or pump strains measured by speckle tracking echocardiography are markers of LV filling pressures, and they have good correlation with the diastolic function. Thank you very much.